Dr. Smith has drilled for this for years. They are well prepared, and I'm very confident that we'll care for this patient appropriately.
Breaking news at 5, an American doctor infected with the deadly Ebola virus headed to Omaha for treatment. Good evening, I'm Melissa Fry.
I'm Adrian Whitsett. Missionary Dr. Rick Sacra was recently exposed to the Ebola virus while serving in Liberia. Soon he will be at the Nebraska Medical Center. Doctors there addressing this case and how they are handling this situation. KETV News Watch 7's Jeremy Maskell was at the news conference that just wrapped up, and he is live with the latest. Jeremy?
Adrian and Melissa, you know, we just heard from doctors here at the Nebraska Medical Center and UNMC for a good 30-40 minutes this afternoon, talking about how the third American infected with Ebola in Liberia is right now headed to the Omaha Metro for treatment here in the biocontainment unit at the Nebraska Medical Center. We know they are in transport right now. We do not, though, have it confirmed from hospital staff that it is Dr. Rick Sacra, though there are several other people confirming that right now. You are taking a look at the biocontainment unit where this patient will be treated over the coming days and weeks. We took a tour of it on August 1st after the U.S. Department of State actually toured the facility to check its readiness to treat patients in this Ebola outbreak right now. It demonstrates the negative airflow protecting other patients in the hospital. It demonstrates the multiple layers of biological security staff say that they will go through to make sure not only the individual with Ebola is best cared for, but also the other patients, the doctors themselves, and the people in the Omaha community are best protected from this deadly virus currently ravaging parts of Africa, and talking about how prepared they are after drilling 4 times a year since this biocontainment unit opened in 2005. This is what doctors had to say just moments ago.
The idea was that we could give this person first-class care in an environment that provides for optimal safety. So we have a special unit with special airflow and pass-through autoclaves and a number of mechanical features, but our most important feature really is our staff.
The tough nature of this disease is just the fact that there isn't any notable therapy other than good supportive care, which we're prepared to provide at the Nebraska Medical Center.
The team that's led by Dr. Smith has drilled for this for years. They are well prepared, and I'm very confident that we'll care for this patient appropriately.
And we know the biocontainment unit here at the Nebraska Medical Center has about 30 staff who actually volunteer to work in these important environments. They say that entire staff has been activated, although the amount of people actually working with the patient at any given time will depend on shifts and how that individual is doing. Doctors say they haven't had the latest update on this patient's condition, mostly because it's such a long and intense journey from Liberia to the United States, but they are going to be meeting with him, meeting with his family and the team of doctors as soon as he arrives to discuss the best options for care. Now, if you in the Omaha community and larger area are concerned about this, the Douglas County Health Department is opening what they call an Ebola information line. It's a phone number going live tomorrow morning at 9 a.m. The phone number is 402-444-3400. It'll be staffed 9 to 4 p.m. Monday through Friday if you have questions about this, but of course we will have so much more about the treatment, about what is ahead on this breaking story later online and on KETV News Watch 7 at 6 and 10. For now, Adrian, Melissa, back to you.
All right, Jeremy Maskell reporting live. Thank you very much. Less than an hour ago, Dr. Sacra's wife spoke to reporters in Boston and says the initial prognosis is positive. The 51-year-old Sacra was in Liberia treating pregnant women. He works with a North Carolina-based missionary group called SIM. Sacra is the third person to be brought back to the United States for treatment.
Rick is clearly sick, but that he was in very good spirits, and he walked onto the plane. So we are really encouraged by that news and looking forward to reuniting with him.
And his colleagues in Massachusetts called Dr. Rick Sacra the consummate family physician. They spoke about him during a news conference Wednesday.
Rick has a heart for Liberia. He, for most of his medical career, he spent time in Liberia, whether it be for, full-time staying there or coming back and forth, as he's been doing for the past year. He even stayed during one of the horrible times of the civil wars where he evacuated his family but stayed behind to make sure that the people had the care that they needed.
Well, a few reminders for you now about what Ebola is. The doctors at the Nebraska Medical Center remind us that it is transmitted only by contact with bodily fluid. It is not an airborne virus. And while Ebola is dangerous, it is treatable under the proper precautions. Just over a month ago, we got inside Nebraska Medical Center's biocontainment unit. That is one of 4 facilities in the entire country equipped to handle a situation like treating an Ebola patient. This actually opened back in 2005 with the idea of responding to bioterrorism cases. As Jeremy reported, it is an isolated, secure area staffed with 30 people who volunteer for the highest risk cases.
We are set up to be able to provide them care and give as much safety as possible to the healthcare workers, to the other patients in the hospital, and to the community.
A portable isopod keeps a contagious patient from contact, even in an ambulance transport. Air pressure works to seal off the space with alarms that sound off if something isn't right. In Nebraska Medical Center, doctors and other local health experts are taking great strides to assure the public that it is safe. NMC has trained for this kind of situation for years.
And we think, considering the way the facility has been designed, considering the expertise we have with that facility, considering our partners, we believe any risk is minimal, and we think there shouldn't be fear, but we understand there will be fear. We stand ready to answer those questions, and with our partners, I think we'll be able to answer the questions as they come about.
And you can watch our original story on the biocontainment lab at the Nebraska Medical Center right now on KETV.com. We will also post all the updates as we get them on our exclusive KETV mobile app.